demonstrate how to hook up the EKG machine. I already turned it on. I have my blood pressure cuff hooked up. I have my pulse oximeter that goes onto the tongue. There, perfect. And then so this is our esophageal probe, and first you want to measure it. It's about right there where the lungs branch off. It does our EKG readings as well as our temperature. Okay. So our respiratory monitor, our EKG machine also does, as well as our blood pressure cuff. So I'm going to hit that button right there to get a reading, and it takes just a few minutes. So our EKG machine kind of tells us as much as possible, but it's always good to trust your instinct as a veterinary technician and listen yourself just to match up, and also check your patient's mucous membranes. A esophageal stethoscope. Normally the stethoscope would be up here, but we don't use this anymore. We have our EKG machine. So we would place it, we would measure first, right next to the heart, place it a little to the left in the esophagus, and that will give us a measurement. And this right here is our gastric tube. You would also enter this into the esophagus down to the stomach, and if you had reflux or anything like that, you can pump the stomach. This is our Canine Neuter, prepped and ready for Dr. Gatlin to perform surgery. Cat ready to go. He's been shaved and prepped. We have our EKG machine set up, so Dr. Gatlin will perform the surgery. I'm now going to do a jugular blood draw on a canine. Our patient is sedated. So you kind of shave where the hair separates right there. And you're going to hold that pressure point to get that vein to pop out. Here we go. Okay, good. So we have a successful jugular blood draw. Okay. So we did get a flash and a little bit of blood. So I'm going to do a medial saphenous blood draw on this cat. Cutter here is my assistant, so he's holding up the leg and pushing down on pressure. So we're going to give it a good shave where that vein is. We don't have to shave too much. Right there is the vein. I have my alcohol, cotton swabs already pre-soaked. We're going to use a TB syringe. We're going to draw black. There we go. I'm going to perform a cephalic IV catheter on this patient. I have my alcohol swabs as well as my iodine swabs ready to scrub. I have gauze in case he starts bleeding. After we place the catheter, I have my saline rinse, my catheter open and ready, and I already put the saline solution inside of it. I have my cap. I'm going to tear off my tape. I have my gauze, and then I have a tourniquet. So I'm going to start by tearing off a good amount of tape and ripping 1/4 of an inch into it. We're going to place it right there. Then doing another one. And I like to go ahead and like pre-fold mine to have it ready. Okay. So Jalen is our assistant that's going to help us. Grab the clippers. I'm going to place my tourniquet. And we're going to shave. The appropriate area for the catheter. Okay, and now I'm going to do it 3 times. I'm going to scrub with my alcohol, then my iodine. And normally you would use like chlorhexidine scrub as well, but we like to use the iodine. Get the whole area clean. And since it's just a puppy, and last one. Okay, now I'm going to place my catheter. Okay, we got a flash, so we're going to advance it. And before I pull it, I'm going to take off my cap. And of course, you have to get to it fast enough or they will bleed. I'm going to clean up around it. Now to tape.
Hey, Lola? Yes, ma'am.
You're going to secure with the tape. Make sure you leave courtesy tabs. Okay. Remove your tourniquet. And now we are going to test to make sure that our catheter is completely in. So I have my flush. And when you do it, it should go in rather easily, and you can feel it using your thumb go into the vein, and I do. So that's perfect. Okay, we're going to cut that out. Okay, there we go. And then, now that our catheter is in, we're going to take a piece of gauze and put it over the cap. And now it's covered. I'm going to do a cephalic blood draw. I have my tourniquet on. I'm going to shave. I'm going to use my cotton alcohol swab. Here we go. Okay, pretty simple. We got blood.